So recording is now in progress. Welcome again to this learning circle on greening. I am your room monitor for today. My name is Raylan. I use she, her pronouns, and I am the Youth Resilience Manager at the Virginia Coalition. And again, we will be together for an hour and I will help keep us on track of time. But I want to introduce our lovely speakers, the reason why we are gathered. So I'm going to read y'all's brief bios and then I'll pass it over to you all. Does that sound all good? Cool. So we are joined first by Cynthia, who uses she, her, hers pronouns. PhD, is a senior evaluator at the Rhode Island Coalition Against Domestic Violence, where she leads the evaluation of the coalition's CDC-funded statewide strategies to prevent domestic violence and supports use of data and evaluation across the organization. Through these roles, Roberts works with staff and community and organizational partners to define, design, and implement approaches to evaluation that are community-centered and focused on meaningful use of evaluation findings. I always love giving folks love in the chat via emojis. So if folks want to do that for our speakers, and I will read Sydney's bio. Sydney, she, her, hers, is the director of prevention for the Women's Resource Center, where she has worked in different capacities within the department for the past 10 years. Prior to taking the director position, Sydney spent much of her time supporting the community outreach and programmatic supports for the Newport Health Equity Zone strategies that are aimed to address the inequities that Newport residents face, supporting the decrease of the many forms of violence that exist. Experience working as both a community organizer and project manager has increased her skills to support the leadership development and convening between both community members and local partners. So without further ado, I will pass it to Cynthia and Sydney. Thank you all for leading this space and I will pass it over to you. Thank you all.
Thank you, and thank you so much for inviting us to be here. Sydney and I would love to know a little bit about folks in the space and like why you're here, what you're interested in as it relates to greening urban spaces and IPV prevention. So we thought maybe we could ask you to put some stuff in the chat that might give us a sense of, for example, did you hear things yesterday? If you were part of the call yesterday, the town hall meeting, were there things that intrigued you? Not only about greening, but this, we all said this is very interconnected work. So are there just things that you want to lift up that you're inspired by, curious about, trying to do? We'd love to kind of go from there and find out what your interests are. And I'm just gonna also, we'll give you some time to put some stuff in the chat. We also wanted to invite people, if you feel so inspired, to have your video so that we could also have a sense of who's in the room, but we also recognize that might not work for you right now, so it's up to you. And Sydney, just wanted to hand it over to you to see if there's anything else along those lines of like intros.
Yeah, sure. Hi, everyone. Yeah, like Cynthia mentioned, I actually couldn't make it to yesterday's session, so I don't know everything that Cynthia talked about. So it would be great for me also to know, like, what are some of the things that people are interested in talking about? Do you want to hear maybe a little bit more of what Cynthia talked about on the panel, and we can go from there if you weren't on the call. So yeah, absolutely, just share a little bit so that kind of, there's so many different avenues that Cynthia and I could talk about over the last like 20 years of us working, organizations working together. So that would really help if we can kind of figure out a road to go down.
Yeah, and Sydney, maybe as we're getting going with that, what you just said about the 20 years of our organizations being in collaboration with each other, maybe we could start out sharing a little bit about our organizational relationship and then our relationship working together.
Sure. Yeah. Do you want to go first as the coalition?
Sure. Okay. So the RICADV, that's short for Rhode Island Coalition Against Domestic Violence, the RICADV and the Women's Resource Center, where Sydney works, we've been in a primary prevention relationship for like 20 plus years. We've been really fortunate to both be our organizations to have been funded by CDC Delta for all those years. And the Women's Resource Center has been our longstanding partner throughout our entire Delta funding. And then also we love to lift up that our original directors of prevention under Delta are both at our respective agencies, Lucy and Jessica. They're now the executive directors for their respective organizations. So we're lucky that we have prevention, perspectives throughout our organizations. Sydney, anything else you want to add about that? And I can also look at the chat and see what people are lifting up.
Yeah, we have a couple good questions coming in. Yeah, I would just say that our organizations have worked together for a long time. We have been Delta recipients for a very long time. And our prevention work has looked different, but also been similar for many years now. It's had its own legs and it's kind of gone in different directions. But we really started doing some youth work, some social cohesion work, community connectedness, at least when I started. So that was it was 10 and a half years ago. Um, Doing social cohesion work, building community connections, creating safe environments. And then really that is how we like to give praise to a lot of our primary prevention and Delta work is how we were able to go ahead and apply. As my bio said, that we are a backbone for the Health Equity Zone, which is a Rhode Island Department of Health initiative that was started over 10 years ago. And there's 14 health equity zones across the state of Rhode Island. And we like to give a lot of praise because we feel like our primary prevention work really put us in a place where we felt like we could go ahead and do this next level of health equity work. And we've been really advanced in that aspect. And I think because of, all of the work that we've done with the coalition, it puts us in a completely different place where we can say, what does primary prevention look like? And it's not just what we were doing in schools, right? Like we're past giving presentations and teaching people about signs and what it means to get out of abusive relationships. Like primary prevention is really about how do you have access? What are the barriers in your neighborhood? All of those things. And yeah, I mean, I think it's just such a unique kind of way that we fell into so much different work. And now that we're doing greening under a Delta grant, I think it's great that, people are starting to see all the interconnectedness of what primary prevention really is versus just like an education piece and being in schools and doing presentations. It's very equity focused.
Thanks, Sydney. I'll riff off of what Sydney was just sharing and try and weave in some thoughts about what I see some of the questions are. I think one of the in terms of asking you about like how can communities do their own work in this and how to build capacity around this. Some things that I've personally observed and then witnessed and grown myself through our collaboration, the RICADV and the WRC and the Newport Health Equity Zone, is really living into what is it like to build strategies off of what residents want as opposed to what the funders are asking to be done. And it doesn't actually have to be mutually exclusive. So like, for example, CDC had a novel strategy one funding cycle ago added to the kind of portfolio of what we could apply for, which was like, there was like a sentence in the technical package on IPV prevention, and it talked about creating supportive environments, but it didn't really have much information about what is that. And that's kind of where the grantees come in, is partnering on the community level to actually like do those strategies and then report back to CDC, to our peers, to the country about what we're learning. And I think having some very creative community-wide ways of collecting data from residents in a really like collegial, respectful, like co-learning way has been such an important foundation, and it's also based in the values of our two organizations, to learn what residents want and to follow residents' direction. And so like the greening, for example, one of the questions yesterday asked, how do you see this work being sustained into the future with all of the changes that we're seeing? And I've witnessed how the HEZ, the Health Equity Zone, has really pivoted based on, you know, whether it's the pandemic that happened or whether it was like unfunded things that residents said they wanted. And there was kind of this hole in the action plan. And then it was like, oh, look at, there's this funding opportunity. So I think just always kind of being ready to implement the things that residents want, even if in that moment you don't exactly have the funding, just being poised to, and always kind of connecting it back to strengthening residents' opportunities. And another thing I mentioned yesterday was how through the HEZ, residents have become certified community health workers and then gone on to become doulas and impact doula legislation in our state. So the greening is like an approach, but it connects to so many other parts of primary prevention. And I'm gonna see if Sydney wants to build on any of that or say something else.
Yeah, sure. I think lifting the resident and community piece, I think one thing that we have learned over the years, and it's something we like to say a lot of, well, first, what we know is that, you know, primary prevention is all about just making your community safer, right? And communities will tell you, residents will tell you exactly what they need in terms of to make their neighborhood or their community safer if you just ask. And it's kind of one thing we like to keep in mind is that although it might not look directly linked to domestic violence in some way, it's our job on the back end to connect it, right? Like we say that a lot. We already know what the community is saying that they need in order to have a safer environment, or they know we get told they need more green space, and we know green space is connected to lowering rates of domestic violence. They don't necessarily need to know that all the time, right? But it's our job on the back end to kind of make that connection. And I say that because I saw something in the chat that said, like, what are some ways that I could be working with others or other programs that can be done? And I think sometimes we think a little too much about what exactly the program should be to decrease domestic violence. And a lot of times it's just asking about what you need in your neighborhood to be safer or what you need in your community to be safer. And then on the back end, we're connecting to what the community needs and how it is decreasing domestic violence. So I say all that because that's where many of our ideas end up coming from, right? Like we're not asking, what do you think is going to prevent domestic violence? We're asking, what do you need in your neighborhood to be safe? What do you need to survive, right? Like we're hearing things we know how to, someone will leave a violent situation is because they need transportation and they need food and they need childcare and all these things, but they, all of that comes out without even having to talk about domestic violence, just your neighborhood and your community and how safe is it and what will make it safer and what will make you feel safe.
Yeah, and I'll add something and then maybe we could just ask if anyone wants to come off mute and react to something or ask more questions or so the other thing I just wanted to add is the health equity zone model, as Sydney was talking about, with the WRC having the capacity that it had, was able to become a backbone for the health equity zone in Newport. And it really does focus across multiple social determinants of health, like transportation, like access to healthy foods, community connectedness, and social determinants such as those. So it's also focused on thriving. So like safety is an important piece and thriving. So that we have the kind of communities where violence never happens in the first place. And I mentioned yesterday, and I feel like there was a theme around this with many of the other speakers, is that we also recognize that there's a continuum between primary prevention and intervention and all in between. And people like we do live in a world where there is violence. So I think the way the has taken like a very humanized approach and not just kind of like putting primary prevention in a silo, but recognizing like people will often be meeting and people will drop in because they need help related to domestic violence. So I think blurring the lines along that continuum has really humanized the work too. And I think that that is as we move into the future, like how can we keep doing the work where we recognize people have lives? It's not just like primary prevention as this ivory tower kind of thing. And then Sydney, does it feel good to ask folks if they wanted to unmute themselves and ask a question or offer a riff? Because we definitely would love for this to be a conversation.
Absolutely. Yeah. And if people don't either, I see a few that we could probably answer from the chat as well.
Yes, folks are welcome of like if the question that's still on your brain is something you shared earlier, coming off of mute and verbalizing that, or responding to anything that was shared around community safety and thriving, around undoing silos, having communities poised, even if the funding or the timing isn't right. Welcome anyone to share anything that's showing up for them.
So I do see one.
So I think because you have two cameras, Amy, there for some reason it's creating a feedback. Um, if you're able to put in the chat, we can read it out loud or whatever feels best for you. And if you're sharing currently, we cannot hear you, but we can see that you're talking. We cannot hear you.
Sydney, is there anything I see in the chat? And I know if Amy's typing in, we can get to your question next. Is there anything you wanted to say, Sydney, about the community gardens? I saw that was a specific question.
Yeah, I was just going to mention that. Rachel is interested in learning more about the process of implementing community gardens. This is actually one of the initiatives under the Health Equity Zone and under our Greening Urban Spaces work group. We we've had some luck with community gardens over the years. The process it's different depending on where you're how fresh you're starting. So there were some plots that were already created throughout the community and they just needed they struggled with getting community engagement within those plots and then there are some areas that we actually had gotten funding to build the plots. So I don't know in which direction if you're starting all the way from, no plots exist, or there might be some plots around where you currently are. But either way, the process is a little different. We have some community gardens actually outside of our community center. So we had written mini grants before, and we had gotten some funding to build those plots with a local partner of ours. And then once they were done, we were able to start a program where we called them Guardians of the Gardens, I want to say is what the name of it was. And residents were actually able to submit their name in a little form that was filled out saying that they wanted to be a guardian of the garden. And really, that was basically allowing them to come and be a leader in those gardens. They would commit to taking care of the gardens. We would supply the water, the tools, everything like that. But they would commit on taking certain days where they're watering or where they're weeding and where they're uh, picking any vegetables or flowers that have come out of it. And then that kind of grew a little bigger from there, where then there was another process of how do we collect the things that are being grown and then now collaborate to getting the things out to the community, right? The vegetables, the flowers, because that is the whole purpose, is if you're growing things in the community, you now want to make sure it goes back to the community. So that was another process in itself, but actually getting the gardens was we looked for some grant funding, but if the grant funding doesn't currently exist, it might be as easy as working with another organization that maybe our organization was a Quidnet Community Table, so they're an organization that already does some planting, some farming, some the farmers markets around town. So they were a good partner because they actually had resources to say the beds aren't that expensive to actually create. And then you can look for, or I mean, you can look for funding to support some of the materials that are needed. But a lot of local partners that are in the food spaces are looking to build more community gardens in neighborhoods now. So they're actually a good person because it's not as expensive for them to have someone. They typically have somebody that they work with that will come and build some type of square bed, and it's not that pricey to get one of those done. And I will say community gardens are so popular right now in so many different communities. It's becoming such a large thing that there is a lot of research on it. On different ways that you can do community gardens. I've actually read some people do them out of some people have greenhouses, organizations have greenhouses, and people can come in and work out of those. But yeah, I would our best community gardens have come out of senior centers, which is a good place to start, and our community centers.
Yeah, and I was gonna build off of what Sydney was saying, and like just listening to what you're talking about, Sydney, there's so many orgs that have different angles on the same issue. So like you were talking about senior centers, there's also people who want to expand pollinator sort of habitat. So often like there will be people more in like the environmental kind of justice areas, like whether it be like nature conservancy people or your local native plant organization, like on the state level or on the regional level, who often, like that's what I've seen, is that it's many points of view that come together to want to support the endeavor. And like Sydney was saying, there's also a maker movement, and one of the partners, makes things, so like they could make the raised beds. So I think coming at it from like a very multidisciplinary perspective increases not only your chances of getting it done, but of also maintaining engagement and growing engagement, to have lots of different types of interests at the table.
Yeah, thank you both for describing what that process looks like and what different partners of like those creative partnerships are really key. If there's a lot of folks interested in gardening and food sovereignty and building connections with them in your community. Um, and so folks express thanks for answering that question. Um, we are also chatting in the chat about funding for programs, and maybe y'all can talk about it from the perspective that you mentioned earlier of undoing those silos of folks showing up with need, and we still live under a culture of violence. And so how can we offer support and build towards the futures we want to see? If folks want to talk on that.
Sydney, do you want me to jump in and then you could continue?
Sure.
Okay, so, curious about, sorry, I'm just looking for the person's name. could you just please remind, oh, Amy, if you, for example, have a state coalition that you're connected to, I think reaching out to the coalition staff can always be like a really good way to kind of spitball ideas and find out what's even going on. Like sometimes there's things happening that you might not even know are happening. So I definitely think that the state coalition is a good resource. And then often they can connect you with their member agencies that serve the community that you're working in. So that's kind of an approach I would take, being someone who works in a state coalition. Sydney, if maybe you have other ideas to add.
Yeah, not too many because that would be our suggestion as a community organization as well. Um, I don't, yeah, because it's the funding piece. I mean, because there are other things that we could talk about in terms of um, we have done different things, as in like other staff members going through some training to be able to do a support group because it's something they're interested in. Um, and we kind of just like rope it into work they're already doing, and it's, you know, something they're interested in and want to grow their skill set in, but not necessarily direct funding to support that. It's either because we can make it work or it's already written into one of our grants. So yeah, I would say that if you're connected with any like local DV program, or the state coalition would probably be your best bet to start having conversations on at least where can they point you in the right direction to see if there's, you know, supports for it.
Sure, and I'd love to invite folks who are on the call, if you have, I know there's a
Mm.
bit of a conversation happening in the thread. If you have additional suggestions for Amy, please feel free to put that in the chat. Something I wanted to lift up because it might not be obvious as we're talking about greening urban spaces and kind of like sustainability and new directions. When I saw Raylan's comment about, ooh, the synapses are firing around potential partnerships. I did want to mention something that the WRC and the Health Equity Zone are really moving into over the last number of years, and it's related to resiliency planning. So as we know, like, you know, there's just a lot of changes going on in the country. So even resilience, you know, is quite likely under a lot of stress, just like in the domestic violence movement, we are too. But for the moment, there is quite a lot of climate resilience funding available. And it's been really inspiring to see how the Health Equity Zone in Newport is bringing different organizations together who have climate resilience planning to work on greening urban spaces. So really creative things like there might be like a environmental group that's working on something that would add resilience to a community would be like getting rid of more impervious surfaces so that water can drain properly. So like there's a project right now in Newport where they're daylighting a brook that currently some of the brook goes under a humongous parking lot at like an abandoned old casino. And so you wouldn't think like, oh, that's a very creative funding idea for preventing intimate partner violence. But more and more, there is literature that helps support the connection between climate resilience planning, community planning, resident engagement and leadership, and preventing multiple forms of violence. So I don't know if Sydney wants to offer any more about that, but I think that's an interesting area of growth.
Sorry. Yeah, I couldn't find my mute button. Yeah, so I think like just to add to that, I mean, a lot of times we are trying to explain some of this. Green space is definitely greening urban spaces as a intimate partner violence strategy is definitely something that is newer to a lot of people, as we are, you know, at least in the spaces I'm even for myself is where trying to understand it and how we share it and show that it is decreasing violence. So yeah, so I mean there are studies that are saying like greening, vacant lots and planting trees and um, kind of creating these cared for public spaces really do lead to significant drops in violence. And I think overall it's, when neighborhoods and residents are feeling, cared for, people are feeling safer in those spaces. And when you have safer places for people to go out and be in, there's more opportunity for those kind of like positive relationship building and connections to happen. And when those are being developed, you have more cohesion and more connection and more places to go and more support. And that's all kind of connected to this intimate partner violence. And the big piece to me is always around like how are we building trust among neighbors and reducing kind of the barriers that exist so that, people are feeling safer in their environments and feeling like they can get away from any situation, but also in the long term, how does this eliminate some of the violence that is being that currently exists in a world that it doesn't exist?
So, building on what Sydney was talking about and answering a question about defining climate resilience. So I'm going to do like very much a person on the street definition. So if you think about how we are experiencing climate change, and we have things like heat islands. So now, for example, in some cities and some states, there's parts of that city where blocks of buildings and homes have a higher temperature because there's like fewer trees or, fewer natural features. So that's part of like the whole equity lens is, for example, in Providence and across Rhode Island, and I know Newport's one of the places too, there's an emphasis on getting, say, like US forestry money to plant more trees in spaces where there's tree inequity to try and increase tree equity. So that relates to, like Sydney was saying, more connected communities, people just feeling better in their spaces, people being protected from the impact of increasing temperatures. And at the same time, it's a climate resiliency strategy in the sense that more trees means more roots that can soak up the water, so that when we have, like those, what used to be called 100-year storms, but now they can happen like twice in a few years nowadays. And like Newport is considered an area, especially the neighborhoods where the Newport Health Equity Zone exists, is often described as like a place at risk of climate gentrification. So like as all these things happen, the storms, happening more often, the many inches of rain happening in short amounts of time, it's creating flooding, it's making tracts of land not habitable in the way that they used to be. So the climate resilience piece is trying to make neighborhoods more resistant, or parts of states more resistant to all of those impacts. And then it also has an impact, of course, on people's quality of life, on the level of stress they experience. And also like knowing that many states in the US have housing crises right now. If your house keeps getting flooded and there's no housing stock, that just creates so much stress for families. So what we're doing is drawing connections among those types of strategies. And I wanted to kind of shoot it over to Sydney to see if you had anything you wanted to add to that.
Yeah, I will also mention, because I feel like we have not mentioned this one little piece, because we keep saying the Newport has health equity zone neighborhood. I should also say that we are focused on only two areas within the entire city of Newport. So when people think of Newport, Rhode Island, a lot of times they think of mansions and, it's right on the ocean and all these beautiful places, which is true. But there is a whole side of the city which is extremely displaced from the rest of the neighborhood. The neighborhood is displaced from the rest of the city. We focus on that because that is actually the highest rates of disparities. It's where almost all of the low income housing developments are. And it is actually over 72% or so of actual residents who live there 365 days a year are actually living below poverty levels. So we like to say that because that is the area that we are focused on. And I will say a lot of climate work is being done in that area because we are actually, despite being the area with the most disparities, low income housing, cut off from the rest of the city, we are also at the highest point of the city, which we are seeing a lot of by, you know, uh, slowly but surely, people are moving closer up. Those people that are living in those other areas of town that are well off, and they are displacing even more so residents that are currently living up. So if we were to have a major storm, or we've seen it already happen a couple times, people want to be at the highest point. They still want to be in the city, but they want to be away from all the water that could be causing damage. And so eventually that kind of pushes a lot of our people out that are currently living in those neighborhoods.
Yeah, thank y'all for sharing the different ways that climate affects violence in our communities and really breaking it down and sharing resources. I'm wondering, want to give an opportunity to the folks in the space. If there's other questions that you're lingering on, um, about how to talk about this in grants or how to share this with communities, what perspectives might resonate with your own community or questions from the panel yesterday. Want to pause in case anyone wants to come off of mute or share anything in the chat.
Hi, Cass person here with the Wyoming Coalition Against Domestic Violence and Sexual Assault. Yeah, I think I'm really interested in like messaging for funders. Like, 'cause I often feel, when I'm talking about, the connection with plants. So uh, I really appreciate what you all are sharing. It's given me a different look. I attend a community-led initiative. I'm a member of the Eastern Shoshone tribe. It's we're not in urban space. We are in like a rural frontier space. And so we come together as a community to learn about native plants that are growing, their uses. An ethnobotanist is also there, helping us identify plants and then harvesting plants, their times. But I think about how healing and life-giving that has felt and for me, and it's also about building those connections with community, building relationships with community, with the land, with the plants. You're getting to know them, and I think about it as, the relationships that you have with plants informs the relationships that you have with yourselves, and then informs the relationships that you have with others. And so it's creating that caring community of connectedness. But I just feel like there's a disconnect when I'm sharing with other folks in the state that, there's not often those connections made. And so just, yeah, really more interested in messaging for funders and making those connections. I appreciate what you all had shared too, that our role is to make those connections for folks of how, it is prevention. So thank you.
Thank you so much for sharing what you did, Cass. And I personally deeply resonate with what you're talking about. I did want to mention that I have seen in the last about year, maybe 2 years, that Alaska, folks in Alaska who are in our prevention community, have shared like on their social media about the kinds of initiatives that you're talking about, where people are getting together. This was Indigenous led, the thing that I'm about to describe, where people are getting together around plants and healing, to do like restorative circles and create community around that. So I know there's some like very specific, very intentional work around plants and violence prevention and restorative practices. That's one instance I'm aware of. I don't know if others would like to offer in the space. But I think, and also there's a funding opportunity that I'm involved with here in Rhode Island, where I've heard on our national community of practice, people doing things like family camping trips. I've also heard of people, I want to say, through one of the TA providers that I think they're out in maybe Montana or Idaho, that do family camping trips where like people cook together outside and enjoy the outdoors together, which I feel like creates some of the same kinds of connections that you're talking about, and they frame it as violence prevention work also. But want to make space for any others.
I will also mention our work group, our Greening Urban Spaces work group, where a lot of this work kind of is held. Our local land trust, or the Aquidneck Island Land Trust, is actually the lead facilitator of that group. And naturally, when we started doing open space work, they just felt like a good fit. But I think over the years, we have them being so involved in so much of the intimate partner violence uh, work has really shifted their thoughts on even what they look like how they operate, and how they are looking at the opportunities that they have, and really how they hold a lot of those opportunities themselves, right? So we have been having more conversations with them about promoting more opportunities for their walking trails and opening up those opportunities more, and all the land that they kind of oversee that's in a trust, opening up those walking trails more, making sure they're promoting it to the right, communities that don't typically have access, even certain, trails that are on water or sand, or different places that they could be. And I know that's not exactly plants, but it is a way of like another organization is over time, it took a while for them to like really see that this work is connected to like decreasing violence, and we have it right in our hands to be able to say, oh, we can open up the trails more often, and it's not a big lift for them, right? And they connect with us, and we're able to really push the opportunities out, and invite our community, invite our clients in our client services, and allow people to have access to things that they, don't typically have access to. So I would say like really being able to connect with kind of, I know it's hard. It's definitely hard work to connect and get people to see the connection. Um, because sometimes it seems so like out of the box, right? Like having a park is decreasing violence. Like some people tell me, if anything, that's increasing it because you're having a park more open more often, or having more things in the park for people to go and do. But it takes it took a long time for our partners to start seeing really the benefits of green space, and connecting that to the community and IPV as a whole. So I'd say it takes time, and I wish I had like a better answer. But um, my hope is that people will come around and see it as more research exists as well.
I think it's another great example of like cross sector collaborations, because I was just really fortunate to have been in Alaska in the last year. And one of the people we were visiting, who's a a peer in used to be in violence prevention, but moved over to education. Through their education work in the state, they had been part of this endeavor to create a deck of cards that were, each card was a separate indigenous plant in Alaska that talked about like the different meanings of the plant's uses, how, how it was related to healing. So that was like someone in the education realm who had these cards. And I just feel like the more that we connect our initiatives across, like plants are just so like meaningful across so many different groups of people and different focuses that people have, that I think, like I've seen it with food justice. I just think the more that we connect across sectors around things that are really close to our hearts, then we start to like forge those connections and deepen them even more.
Yeah, thank y'all for sharing other work that you know exists, working with Indigenous folks to lead this work and just offering support. Um, and I can share, there's a local program here in Virginia that's in a rural community, but it's also a learning garden. So they hold sessions of how to harvest the food and then also cook with the food, to build that community connectedness and cohesion to the land. But thank you for that question, Cass. And yeah, thank you again for uplifting your voice in the space. We have about 10 minutes left. If there are other things folks are thinking about or want other perspectives on, to think through in the space with others, want to pause again to give folks time. If you want to respond to any of the resources shared in the chat, want to give you an opportunity to do so. Well, folks are thinking, I was scrolling back up to what folks shared in the chat earlier to see if we captured some of the questions or like why folks showed up in the space. Um, and maybe we can briefly talk about how this work also encompasses across the lifespan. I think y'all mentioned earlier how a lot of times prevention, like folks immediately go to like, I have to get in schools and I have to do this many sessions, but the opportunities that greening provides to working across the lifespan, maybe we can talk about that. If not, that's also okay.
Sydney, I was thinking about how Tisha would do her breastfeeding group in the park and at the farmer's market. And just the work that Tisha's doing makes me think about this work across the lifespan and across different disciplines. I don't know if you want to share more about her role as a resident leader as an example to illustrate.
Yeah, sure. So we have resident consultants among the Health Equity Zone project, and those are residents that are just really invested in the project and want to be a part of it and want to do some work, and we actually pay their time as well. They sit on working groups, they do projects, it's a way to make sure that resident voice is incorporated into everything that we do as a community project, a community collaboration. We just want to make sure that residents are, their insight, their voice is a part of the project from beginning to end, no matter what we do. So one of our residents that have been with us since the very beginning, for a very long time, she's very known in the community. Was doing different types of work, and then had decided, had many experiences with our local hospital, and decided that she wanted to become a lactation consultant because she wanted to run breastfeeding support group specifically for women of color, because the experiences at the local hospital were not as welcoming and inviting as they should be. And sorry, I'm reading another message as it comes in. Those are bad for me. I shouldn't keep up the messages as I'm talking. And she felt very strongly about, while we are trying to educate and do some changes in the hospital, we should be creating a space for women to come where they feel comfortable learning about breastfeeding, where they feel like they have a connection to each other. So we started this group and we were doing open space work at the same time. And Letitia thought that it would be a great idea to run her breastfeeding support group in the park. So we had regular sessions in the park, where women actually from the community felt more comfortable coming to the park, and being able to use that as a safe space, to be together, and learn about, breastfeeding support. But it wasn't just breastfeeding support that came out of it, right? Like they were creating this circle of trust and of friends and of like people that they were connected to that they then can go to for anything else because they've developed those relationships based off of one thing. And it was outside their home. It was somewhere safe. It was somewhere they could meet up regularly with them. And then they started having, right? Then they brought their kids to the park while they were doing some of these. Then they were introduced to, different things that were happening in the park while they were there. And it really started kind of opening that space up for, residents to come and go to a place where they normally just really didn't feel like they would, welcomed, like they would use the park. But they started using it as a place where they could gather, where they could connect, where they could, you know, really form those connections that maybe wouldn't have formed otherwise if this group didn't start.
Yes, thank you so much for sharing that story and like the possibilities that that support group created. And so we have 5 minutes left, and so maybe we can close out with Denise's question around those unexpected costs for creating and running a community garden.
Um, so we didn't, so when we first, I will, to be 100% transparent, when we started the community gardens, um, we had more than enough money that when we ran into a couple unexpected things, they weren't super unexpected. They were just things that we were thinking were like learning curves of what we needed. Um, I would say now so our community gardens, because we have the collaboration with the local partner, things are easier because they have access to all of these things, right? Like they have the vehicle transportation if there are, we're so close to the community center too, I should say, that we don't typically use the vehicles to transport, that we are able to house a lot of stuff in the two community centers that the gardens are outside of. But in terms of funding, we had written for it and we had received more than enough funding that we needed to get it started. If we had to do all of that over again, we probably wouldn't be able to do it. As everybody probably knows, with everything being cut, there's like no more community gardens, no more. But I think that is something that when you start thinking about those community gardens, of some things you could kind of cut corners with too. Like, is it near community space where they could then let you use a closet or something to hold some of your supplies? In terms of like soil testing and stuff, I'm not quite sure about what that was done on our end or anything. But that might be something that the Aquidnet community table, which is our really the food hub on the island, does some of those pieces. But yeah, I mean, I will say like storing the tools and stuff, if there's a local place that you could be very close to and have it all there. We actually, if we ever do need a vehicle, we partnered with another organization who actually has a van, like your local Boys and Girls Clubs, things like that will sometimes allow you to just use a van. As long as they're not using it to then transport. You could also say, like, maybe one day we would love to open it up to the kids and they can come learn how to garden. Or bring their families one day on a Saturday morning and they can learn how to garden. They love to partner for things like that. But yeah, I would say there wasn't too many unexpected costs. I think community gardens is actually something you can do relatively cheap. If you can have somebody build the garden, it's really maintaining the supplies that you would need. But other than that, a lot of community members will come and do it just because they want to have ownership over something and support gardening and then teach. Sometimes, we've had people come with their children and their grandchildren, and they just love to be able to help that. Of course, we would pay the leaders who are kind of overseeing the gardens that were coming regularly to garden and all. But over time, when they really would tell us, like, we would do this regardless because this is something that we really care about having in the community. So yeah, I think, if you don't have a lot of money to work with in terms of like building and stuff, I would talk to a couple community partners that are maybe in the food spaces and even open spaces and see if they can help.
Yes, thank you for offering that. And Cynthia, I also saw you in the chat saying extension programs at land grant universities can also be great resources. I'm also looking at our time. We are 1 minute till, but maybe if y'all have any closing remarks while I share your emails in the chat, if that's okay. Um, and then folks can go off in a green headspace into the rest of the day.
Sure, I'd love to do something, a closing remark, and pass it over to Sydney to close us. I just love the fullness of our conversation today. I just feel really inspired by what people are doing and thinking about. So I loved seeing the questions in the chat. I loved the comment about that Cass had just about this like deep connection with plants and like ways to engage people through means like that are so personal and just so deeply connected to our humanity. So I think that's what I'm leaving, just thinking about the stories that Sydney shared about Letitia and the work that she did. I just feel so just full and very whole. And I just love feeling that way about this work because it's tough times, and I just appreciate the inspiration. So thank you everybody so much.
Yeah, I just want to say thank you to everyone. Also, I know this is so much to talk about in only an hour, right? Like I think I say this to Cynthia all the time, like I forget that we do this all the time. That really breaking it down and talking about how we just got a grant that was like, you're going to do greening as an intimate partner violence strategy, right? Like that's how it all started. Um, but I would love to talk more with anyone who wants to, have a conversation offline, um, about how we really just like started from the very beginning of like, okay, we're going to do open space work. What does that look like? How did we do our very first assessment on like what people want to see related to open space in their communities? And we have so much we could share on that. So, I would love to have more conversations if people want to have a conversations outside of this, on, really how we got the project going and how, we've been doing it for a while now, and there's still so much more to learn. And I'd love to learn from all of yous on kind of what you guys are doing as well.
Yay. Oh, I've learned so much. I was taking notes over here. But thank you all for sharing your experience and wisdom with us. And thank you all for showing up in this space. That concludes our learning circle for today. I hope to see you in other learning circles to continue conversation. And I wish you wonderful rest of the day and rest of the week. Thank you all so much.